The ankle circumference is measured before the treatment begins. The application of compression systems threatens the skin by friction and shearing forces, and most often causes irritation and dryness to the skin. Regular intensive skin care of the lower legs prevents irritation. Very high moisture needs are met by foam products containing urea. The new Job's multi-layer bandages contain all components needed for adequate compression in the treatment of venous leg ulcers. Job's CompriApp No. 1 is a padding bandage for the protection of bony prominences. Start at the base of the toes. Apply smoothly and evenly onto the flexed foot without stretching the material. Make sure the heel is completely covered. Then work up the leg in a spiral with 50% overlap. Finish just below the knee, the tubal tuberosity. Cut or tear off excess bandage. You can use the remaining padding material for additional padding and protection of prominent bony areas. Use additional padding for thin legs to reach an ankle circumference of at least 18 centimeters or 7 1/8 inch. Job's CompriApp No. 2 is a bandage for further padding and absorption. Now start at the base of the toes. Again, anchor the bandage with 2 turns around the foot. Bring the bandage tightly under the arc of the foot and the bottom of the heel. Work up the leg using a spiral technique. Ensure a 50% overlap with every turn. Finish by cutting any excess bandage to leave a straight line. If necessary, use adhesive tape to secure the bandage. If you use Job's CompriApp Light or Job's CompriApp Light Latex Free for reduced compression, proceed with the application of Job's CompriApp No. 4. Job's CompriApp No. 3 is a long stretch bandage which adds the first layer of compression. Again, give the bandage anchorage with 2 turns around the foot. Pass behind the Achilles tendon and ensure a tight fit on the heel. Then take the bandage across the front of the foot with an extension of 50%. Pass it horizontally across the Achilles tendon and, still at an angle of 45 degrees, move downward to the front of the ankle by using a figure 8 technique. Continue with the figure 8 technique while ensuring a 50% overlap with the help of the central line on the bandage. The application of Job's CompriApp No. 3 with a spiral technique with a 50% overlap would result in a slightly lower compression. Finish at the same place as before. Cut any excess bandage and secure the bandage with tape. Job's CompriApp No. 4 is a cohesive bandage with short stretch properties. Anchor the bandage with 2 turns around the foot. Work around the Achilles tendon and cover the heel with 50% extension. Then fit the bandage under the arc of the foot and work upward across the foot. Continue up the leg to the tibial tuberosity in a spiral with 50% overlap. Finish at the top by cutting the bandage. Ensure the bandage is not stretched on the last 15 centimeters, or approximately on the last 6 inches. Secure the bandage by pressing lightly. The cohesive material will form a permanent bond and secure the bandage. Smooth out the layers with your hands and examine for any gaps in the compression bandage. Use scissors for removal of the system.